Let's talk about turf toe, a really difficult injury in high-level athletes. I'm Dr. David, orthopedic surgeon and sports medicine expert. Turf toe is sort of a generic term for an injury of what a lot of people call the ball of your foot. The technical area is the first metatarsophalangeal joint, or first MTP joint. This is right below the great toe. We typically see this in football players. It was nicknamed or called turf toe because we would see it when athletes would play on artificial turf and they'd get this injury, so it became known as turf toe. But you can certainly get it in grass. It's basically an injury where maybe a running back or wide receiver is running and they're pushing off so that the ball of their foot is sort of extended, and then maybe somebody lands on the back of them or the back of their leg, driving that foot down toward the grass or down toward the turf and stretching out the bottom of that joint. Again, the first MTP joint. And that can rupture the tissue that holds up that joint. It could rupture one of the tendons or injure the sesamoids in that area, but it's a very, very painful injury. We typically, for a sport like football, really have to shut an athlete down. Sometimes even make them non-weight bearing, not just no football, but keep them completely off it. Sometimes you can, with non-surgical treatment, there are extensions that you could put into an orthotic or something that keeps that ball of the foot rigid still while you're trying to get around. Sometimes that can help. Occasional cases, and this right after it happens, most people don't need surgery. It's when it just doesn't get better with non-surgical treatment that we talk about as surgery. But in high-level athletes especially, it's worth getting it seen fairly soon because the surgery early is probably a little bit easier than a big reconstruction down the road. But this is a long problem, even if it's just a stretch of those ligaments, because of how much you need to be able to push off and use that joint to push off to sprint or to change directions. I mean, that can be 6 to 8 weeks minimum, but could certainly be months and months. So definitely worth seeing an orthopedic surgeon, a foot and ankle orthopedic surgeon, or a sports medicine orthopedic surgeon. Get it checked out, find out what you can do to heal and get back to sports. If this video was helpful, click the video below for much more useful information, and I look forward to seeing you next time.